An organized differential diagnosis is exactly what a framework is. That is all a framework is. It's an organized differential diagnosis. And here is the differential for, or the framework for systemic vasculitis, organized by size of blood vessel involved. We have large vessel, medium vessel, small vessel. If I have this in my mind, it's much easier for me to recall this list. And it's much easier to approach a patient with systemic vasculitis if I have this framework in mind. And that's one of the benefits of the framework system, is it helps you with memory and recall. They did studies in the 1950s and 60s where they gave one group of individuals a list of words that were linearly listed and at random, and asked them to memorize that list. They gave the same list of words to a different group. And instead of being a single list, those words were organized in some way. Like this is an example of a list of minerals that were organized into a framework. And the group that had the benefit, and again, both groups were asked to memorize these words and later tested on it. The group that had the benefit of a framework or organization were much more successful at memorizing that list of words. So having a framework for a problem will allow you to recall and remember that differential diagnosis a lot more easily. Another sort of benefit from having a framework is it, depending on the framework, can suggest a diagnostic workup. So if we look at the framework for systemic vasculitis and we look at the small vessel arm, that subdivides into whether patients are ANCA positive or ANCA negative, anti-neutrophil cytoplasmic antibody. And so if I'm approaching a patient with who I think may have small vessel vasculitis, and I have this framework in mind, it automatically suggests to me a serologic study to send. And the same is true for the framework for pleural effusion, which divides causes into transudates and exudates, which is of course based on Light's criteria. And so if I have this framework in mind and I'm approaching a patient with a pleural effusion, it automatically tells me that number one, I have to sample that fluid with a thoracentesis, and number two, I have to send that fluid for protein and LDH in order to calculate Light's criteria. Here is the framework for hyponatremia. Same thing. If we look at the hypotonic arm, this subdivides by volume status: hypovolemic, euvolemic, hypervolemic. And if I'm approaching a patient with hyponatremia and I have this framework in mind, it automatically tells me that I need to pay close attention to volume status when I'm examining this patient.